Over 700 people are diagnosed with mouth, head and neck cancer in Ireland every year. While this cancer mainly affects men and older individuals, the number of women and younger people being diagnosed is increasing. With regular self-examination of your own mouth and neck, these cancers may be detected at an early stage. So it's time to watch your mouth, because early detection is very important for successful treatment of these cancers. The risk factors for mouth cancer include smoking, drinking alcohol. If you smoke and drink alcohol, you increase your risk substantially. The human papillomavirus, or the HPV virus, and finally, overexposure to sunlight. What can you do to detect mouth cancer? It's important to be familiar with your own mouth. Your mouth should be moist, and depending on your own ethnic origin, the tissue or the skin in your mouth may vary from pink to brown. To do your mouth check, make yourself comfortable in front of a mirror with a good light source to see inside your mouth. And now, watch your mouth with these 6 simple steps. Step 1. Look at your lips. They should be pink and soft. Hold out your lips and check inside your upper lip first. You may notice the frenum, which is normal. And then look inside your lower lip. You may see some small bumps, which are tiny salivary glands. Or you may see some tiny blood vessels. Your gums should be tight around your teeth and not swollen or bleeding. Step 2. Now check inside your cheeks. Let's start with the right hand side. You may notice the opening of the saliva gland, or you may notice a small white line which can be caused by cheek biting. These things are normal and you don't need to worry about them. Now check your cheek on the left hand side, making sure that there are no obvious colour changes or hardness in the tissues. Step 3. Open your mouth as wide as possible to check the roof and back of your mouth. Look at the roof of your mouth, the hard palate and the soft palate. Now look at the back of your mouth. Use your toothbrush handle to hold your tongue down so that you can see your tonsils on the right and the left hand side, and also the uvula, which is the wobbly soft bit in the middle which hangs down at the back of the soft palate. Step 4. Stick your tongue out and examine it. You may notice some small lumps at the very back of your tongue. These are called circumvallate papillae and are quite normal. Now examine both sides of your tongue. The tongue is quite slippy, so you may find a tissue useful to hold the tongue out while you examine it. Run your finger along the side of your tongue. It should feel smooth and soft to the touch. Step 5. Now lift your tongue to the roof of your mouth and use your finger to gently feel the floor of your mouth underneath and at each side of your tongue. You may notice the blue blood vessels in your tongue, or you may notice the salivary glands underneath your tongue in the floor of your mouth, which are normal. And step 6. In the final step of watch your mouth, it is very important to check your neck for any recent change, such as a lump. So now that you know how to watch your mouth, it's important to know what you're looking out for. The symptoms of mouth cancer include a sore or ulcer in your mouth that doesn't heal, a recent lump in your mouth or neck, difficulty swallowing, chewing or moving your tongue, a sore throat or persistent hoarseness, and finally, white or red patches that appear in your mouth. It isn't uncommon to have an ulcer or a lump in your mouth, and most of these heal within a few weeks. However, if you do have any of these symptoms which last for 3 weeks or more, it is very important to get them checked out as soon as possible by your doctor or your dentist. Do not smoke or drink. Eat a healthy diet and always protect yourself from the sun. Visit your dentist for a checkup every year, even if you do not have any remaining teeth. Be familiar with your own mouth and regularly check for any changes. If you have any changes in your mouth or neck for more than 3 weeks, get checked promptly by your dentist or doctor.